Rahim. This is Dr. Shahzeb Ahmed. Today's our topic is fetal circulation. So, umbilical vein is a conduit which is a single conduit from maternal circulation to fetus, and it supplies the oxygenated blood to the fetus. Its oxygen saturation is 80% and partial pressure of oxygen is 30 millimeter mercury. So, the other way, there are two umbilical arteries which are draining the deoxygenated blood from the fetal circulation to the maternal circulation. Now, in fetal circulation, there are three important shunts which we are going to talk about. Number one shunt is in the liver. When umbilical vein supplies the oxygenated blood to the fetus from umbilicus, it enters and goes directly to the liver. But as in cases of adults, this blood must be supplied to the sinusoids present in the liver and then must be collected back from the other side. But in case of fetal circulation, there is a ductus venosus which shunts all the sinusoids and directly supplies this blood to the right heart, because we cannot afford the delay, this much delay, that it can be supplied to the sinusoids and then then all the detoxification of the blood occurs there, and the first pass effect occurs in adults there in the liver sinusoids. We do not have this much time because this conduit is supplying oxygenation of the blood. In case of adults, blood enters the liver from all the gut, and there is no connection of the oxygenated blood supplied to the liver. So we can provide all the blood to the liver, and it can get detoxified there, and a lot of things happen to the blood actually there. So it can be collected from the other side and give it to the heart. But in case of fetus, we cannot do that. We have oxygenated blood, and that must be very readily available for the cells to consume and combust all the glucose which is been provided to the cells. So this is number one shunt. Number one shunt is in the liver, and the name is ductus venosus. Then comes another shunt. This is inside the heart from right atrium to the left atrium. The name is called foramen ovale. This is just like a valve. If this is right heart, so blood pushes this septum secundum away and enters just like a valve mechanism, enter to the left heart, and when this chamber closes, this septum comes back and this becomes a valvular mechanism. So this is another shunt. The name is called foramen of ovale. In adult, this becomes closed because when a fetus takes a deep breath, so right heart, which initially in the fetus was very high pressure circulation, right side of the circuit becomes low pressure circulation, and this foramen which initially was just like a valve, this becomes a closed structure, and it collapses together and gets fibrosed there, and the name is called fossa ovalis. So adult remnant of foramen ovale is fossa ovalis. This is the second shunt inside the heart. Then comes the third shunt, which is from which connects pulmonary circulature to the aorta. So that also is a little bit of blood that goes to the right circulation, that also comes back and is been shunted to the left circulation. So these are all three shunts. They are trying to help the fetus get oxygenated blood as readily as possible, and they also help bypass the sinusoidal low pressure area of because it will alternatively dampen all the pressure that has been maintained by the maternal circulation to the fetus. So first shunt liver, it bypasses the sinusoids, Then comes the fossa ovalis, bypasses the heart, bypasses the lungs, which is a very high pressure circulation, and then comes the third shunt, which also helps to bypass the high pressure lung circulation. Okay ji. So what are the important clinical relevations about all these shunts? Number one, if they stay open in the adult life, they become very problematic for the patient, and sometimes need surgery. Sometimes these shunts are important for the survival of the fetus in cases of if the truncus arteriosus does not separate, and there is only a single conduit from heart to the both the circulation, then this becomes very difficult for a person to. Okay. If both the circulations become exclusively disconnected, just like the aorta drains the right heart, and pulmonary arteries drain the left heart. So this condition is called transposition of great arteries. That means the septum, which had to spiral in the outflow tract, did not spiral, and it becomes a how can I tell you? So conduit, there was a conduit, and the septum had to spiral just like this, going out. So that the right heart becomes connected to the pulmonary arteries, and left heart get connected to the aorta, alternatively to the other side. But if this does not spiral, so right heart becomes connected to the aorta, and the left heart gets connected to the pulmonary arteries. So oxygenated and deoxygenated blood, they do not mix together, and the oxygenated blood keeps on circulating inside the right heart, and deoxygenated keeps on circulating inside the left heart. In that case, we need all these shunts to remain open for the viability of the fetus. Okay, so either we need these shunts open or closed, depends upon all these things. So normally, if a fetus is normally born, so we need all these shunts to close. So when a fetus is born, it takes a deep breath, and the oxygenated blood, the oxygen saturation, which initially was 80%, becomes very high. It becomes above 90, and 96, 98. So we get the prostaglandins which keep ductus arteriosus open. Prostaglandins E1 and E2, they both decline in their blood level, and the blood level of the prostaglandins E1 and E2, it declines. It causes the ductus arteriosus to close just once. So when prostaglandins decrease, ductus arteriosus closes, and I have already told you about the foramen ovale, how does it close. So it is just like a valvular mechanism, and if the pressure in the left atrium increases, it causes the septum secundum to permanently get attached to the septum primum, and it becomes fused there. So if we want to keep if we want to keep the foramen ovale, the ductus arteriosus open, we have to make sure there are enough of the prostaglandin E1 and E2 in the blood. And if we want the ductus arteriosus to close, we give indomethacin, which is a non-steroidal anti-inflammatory drugs. It works on the cyclooxygenase pathway and decreases the levels of prostaglandin E1 and E2 in the blood, and in that manner it helps close the ductus arteriosus. So that is a little bit about the fetal circulation. Now we move on to the adult remnants of the fetal circulation, allantois. Allantois is a connection of umbilicus to the bladder. So in adult, its remnant is called median umbilical ligament. Urachus is a part of allantotic duct between bladder and umbilicus. It sometimes stays open and there is a fistula between the bladder and the umbilicus, and sometimes it has a proximal and distal obliteration, but inside of it there is a fluid collection which is called urachal cyst. So sometimes it is communicating, umbilicus is communicating with the bladder. Sometimes there is a cyst, insisted some fluid collection with distal and proximal obliteration, and sometimes there is just only a diverticulum of the bladder towards the urachus. So that is called urachal diverticulum. Okay, the ductus arteriosus. Ductus arteriosus is was a first shunt. The adult remnant of ductus arteriosus is ligamentum arteriosum. It becomes fibrosed there, and blood is started to get delivered to the sinusoidal spaces, and then is collected from the other side in the form of portal vein and inferior vena. Okay, ji. Then comes foramen ovale. I have told you about the adult remnant is fossa ovalis. Notochord. Notochord is the structure which is formed in the epidermal layer of the embryo, and notochord I will have to make a diagram for that. Most of the times I get very difficult, it gets very difficult to elaborate a thing without making a diagram, so I become a little bit, because my habit is to draw things and then to elaborate, so I am getting a little difficulty in that area. So notochord is actually the structure around which neural tube is formed. So neural tube, when neural tube gets converted into the spinal cord, and notochord, it is surrounded by the paraxial mesoderm. So paraxial mesoderms, both sides, they form bodies of vertebra, and they fuse together, and then this becomes gradually becomes vertebral column. But notochord, which was initially the main blueprint around which paraxial mesoderm and notochord and the neural tube, they both developed, now becomes the nucleus pulposus of the disc, intervertebral disc. It has a nucleus pulposus, and around that is a ligament. Okay, there is some, the disc has a fibrous structure around it. Fibrous structures has some name, I don't remember right now, and inside of it is a very thick gelatinous material which is called nucleus pulposus. So the nucleus pulposus is the adult remnant of notochord. ठीक है जी. Next come umbilical arteries. They join around on the both side of the urachus, and in the center there is a median umbilical ligament which is adult remnant of urachus, and on both sides of those median umbilical ligament, two umbilical arteries just like this, they come together and they form medial umbilical ligaments. Median means central, and medial means around the central, but medial, but like towards the midline. Okay, so umbilical vein, it forms the ligamentum teres of hepatis. Ligamentum teres hepatis, which is a round, which is also called round ligament of liver. So it is basically enclosed within the falciform ligament. So once I make a diagram, it will become very easy, very palatable for both of the parties. So actually I didn't get the chance to get to the whiteboard and draw things for you. So next time when we'll have a discussion, we'll have a detailed discussion. I'll draw things for you and make diagrams, and some of the PowerPoint animations as well. So thank you so much. This was all about the fetal circulation.